of medical equipment, every hospital bed, every healthcare worker, and every oxygen tank is needed to save lives. Therefore, under the strengthened regulations, the sale of alcohol from retail outlets and on-site consumption of alcohol will not be permitted. The prohibition on consuming alcohol in public spaces like parks and beaches remains. Distribution and transportation will be prohibited with exceptions that will be explained by the minister. These regulations may be reviewed within the next few weeks if we see a sustained decline in infections and hospital admissions, as we did before. In effect, the adjusted Level 3 regulations will keep the economy open while strengthening measures to reduce transmission. With a few exceptions, businesses may continue to operate as long as all relevant health protocols and social distancing measures are adhered to. Nightclubs and businesses engaged in the sale and transportation of liquor will not be allowed to operate. The Level 3 restrictions will remain in place until the 15th of January 2021. These measures will be reviewed at that time on the basis of the state of the pandemic in our country. When I last addressed you, I indicated that in managing the pandemic, we would follow a differentiated approach that took into account the rise in infections in particular municipalities. Municipalities defined as hotspots will be subject to additional restrictions until there is a clear and sustained decline in infections. Following a review of the latest available data on infections and hospitalizations and consultations with affected provinces, Cabinet has decided that the following further areas be declared coronavirus hotspots. In the Eastern Cape, these are Chris Hani District, Buffalo City, Amatole District, Alfred Nzo District, and the OR Tambo District. These are in addition to Nelson Mandela Bay Metro and the Sarah Bartman District, which have already been declared hotspots. In KwaZulu-Natal, these hotspot areas are eThekwini, Umgungundlovu District, Ugu District, Herigwala District, King Cetshwayo District, and Ilembe District. In Gauteng, the West Rand District, Tshwane, Ekurhuleni, and Johannesburg are declared hotspots as well. In the Western Cape, the West Coast District, Overberg District, Winelands District, Cape Town, Central Karoo District are hotspots. This is in addition to the Garden Route District as well. In the Northwest, Bujanala District is declared a hotspot area. And in Limpopo, the Waterberg District and the Capricorn District are declared coronavirus hotspots. When I last addressed you, we announced that certain beaches in our country would be closed on certain days and others would remain open. As the infections continue to rise, Cabinet, on the advice of the National Coronavirus Command Council, has decided that all beaches, dams, lakes, rivers, public parks, and public swimming pools in hotspot areas will be closed to the public with effect from tomorrow. National and provincial parks and other parks where access control measures and entry limitations are already in place may remain open to the public. Those living in hotspot districts are strongly advised and encouraged to minimize their travel within the district to essential travel so as to minimize contact with other people. Travel to hotspot districts should be avoided by all of us if possible. The stark reality is that every single district in this country has the potential to become a hotspot unless we observe the current preventative measures. As we intensify our efforts to prevent further infections, we continue to work to ensure equitable access to an effective COVID-19 vaccine. As we have reported before, South Africa is part of the global pooled procurement initiative coordinated by COVID-19 Vaccines Global Access Facility, commonly known as COVAX. We can confirm that we have signed off on the agreement with COVAX, and the Solidarity Fund has made the initial payment of 283 million rand to the facility. We are grateful for the support we continue to receive from the Solidarity Fund across all areas of our COVID response. We should remember that the Solidarity Fund is a multi-sectoral funded initiative, having received funding from government, a number of individual South Africans, also from various institutions, including political parties, as well as business corporations. We are part of the first group of countries that will receive an allocation of vaccines from COVAX. We have been advised that we should expect the vaccines in our country in the second quarter of 2021. We are also having parallel bilateral discussions with a number of vaccine manufacturers and will make further announcements once firm agreements are in place. As a country, we need to build a strong partnership between the government and business to augment the resources required in financing additional vaccines necessary to achieve herd immunity. Engagement to this effect are at an advanced stage, and we urge the private sector to continue their participation in this endeavor. And we applaud them for having embarked on an initiative that will be beneficial to all South Africans. But announcements in this regard will be made in due course.